And they will keep on doing this for as long as they can get away with it. I mean, there's no secret they're telling their investors this. We are in the money. We are going to keep on making big profits, even though a lot of folks are going to be put under hardship. So how much higher do premiums have to rise until we do something about it? How many more Americans have to lose their health insurance? How many more businesses have to drop coverage? All those young people out here, after you graduate, you're going to be looking for a job. Think about the environment that's going to be out there when a whole bunch of potential employers just tell you, you know what, we just can't afford it. Or, you know what, we're going to have to take thousands of dollars out of your paycheck because the insurance companies just jacked up our rates. How many more years can the federal budget handle the crushing costs of Medicare and Medicaid? That's the debt you're going to have to pay, young people. When's the right time for health insurance reform? Is it a year from now, or 2 years from now, or 5 years from now, or 10 years from now? I think it's right now, and that's why you're here today. Now, Leslie is a single mom, just like my mom was a single mom, trying to put her daughter through college. She knows that the time for reform is now. Natoma Canfield, self-employed cancer survivor from Ohio, she wrote us a letter. Last year, her insurance company charged her over $6,000 in premiums, paid about $900 worth of care. Now they've decided to jack up her rates 40% next year, so she's had to drop her insurance, even though it may cost her the house that her parents built. Natoma knows it's time for reform. Laura Klinska, this is a friend of mine, somebody I met when I was campaigning in Wisconsin, Green Bay, Wisconsin. She's a young mother. She's got 2 kids. She thought she had beaten her breast cancer, but later discovered it had spread to her bones. She and her husband had insurance, but their medical bills still landed them with tens of thousands of dollars worth of debt. And now she spends her time worrying about that debt when all she wants to do is spend time with her children. I just talked to Laura this past weekend. And let me tell you, she knows that the time for reform is right now. So what should I tell these Americans? That Washington's not sure how it will play in November? That we should walk away from this fight? Or do something like some on the other side of the aisle have suggested? Well, we'll do it incrementally. We'll take baby steps. We'll do well. So they want me to pretend to do something that doesn't really help these folks. We have debated health care in Washington for more than a year. Every proposal has been put on the table. Every argument has been made. I know a lot of people view this as a partisan issue, but both parties have found areas where we agree. What we've ended up with is a proposal that's somewhere in the middle. One that incorporates the best from Democrats and Republicans, best ideas. Think about it along the spectrum of how we could approach health care. On one side of the spectrum, there were those at the beginning of this process who wanted to scrap our system of private insurance and replace it with a government-run health care system like they have in some other countries. Look, it works. It works in places like Canada, but I didn't think it was going to be practical and realistic to do it here. On the other side of the spectrum, there are those who believe that the answer is just to loosen regulations on insurance companies. This is what we heard at the healthcare summit. They said, well, you know what? If we had fewer regulations on the insurance companies, whether it's consumer protections or basic standards on what kind of insurance they sell, somehow market forces will make things better. Well, we've tried that. I'm concerned that would only give insurance companies more leeway to raise premiums and deny care. So the bottom line is, I don't believe we should give government or insurance companies more control over health care in America. I believe it's time to give you, the American people, more control over your own health insurance. And that's why my proposal builds on the current system, where most Americans get their health insurance from their employer. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. But I can tell you, as the father of 2 young girls, I don't want a plan that interferes with the relationship between a family and their doctor. So we're going to preserve that. Essentially, my proposal would change 3 things about the current healthcare system. Listen up. First, it would end the worst practices of insurance companies. Within the first year of signing healthcare reform, thousands of uninsured Americans with pre-existing conditions would suddenly be able to purchase health insurance for the very first time in their lives, or the first time in a long time. This year, insurance companies will be banned forever from denying coverage to children with pre-existing conditions. This year, they will be banned from dropping your coverage when you get sick. And they will no longer be able to arbitrarily and massively hike your premiums, just like they did to Leslie or Natoma or millions of other Americans. Those practices will end. If this reform becomes law, all new insurance plans will be required to offer free preventive care to their customers starting this year, free checkups so that we can catch preventable diseases on the front end. Starting this year, there will be no more lifetime restrictive annual limits on the amount of care that you can receive from your insurance companies. There's a lot of fine print in there that can end up costing people hundreds of thousands of dollars because they hit a limit. If you're a young adult, which many of you are, you'll be able to stay on your parents' insurance policy until you're 26 years old. And there will be a new independent appeals process for anybody who feels they were unfairly denied a claim by their insurance company. So you'll have recourse if you're being taken advantage of. So that's the first thing that would change, and it would change fast. Insurance companies would finally be held accountable to the American people. That's number one. Number two, second thing that would change about the current system is this. For the first time in their lives,